You know, when we think about a hospital stay, our minds usually jump to the big things, right? The surgery, the medicine, the doctors and nurses. But what if one of the most critical factors for getting better is something that's often hiding in plain sight? Well, in this explainer, we're going to pull back the curtain on that hidden factor.
So let me ask you this. Beyond the obvious risks, like an infection or a complication, what's another major hurdle patients face? It's something that can quietly undermine the healing process for almost anyone, no matter why they're in the hospital.
And that silent problem? It's hospital malnutrition. It sounds simple, but it's a huge deal. It's when patients just aren't getting the fuel, the nutrients their bodies desperately need to heal. And tackling it requires a really smart step-by-step approach. So, first up, let's dive into this hidden problem and see why getting a handle on a patient's nutrition is the absolute first step on the road to recovery.
The whole game plan really boils down to a two-part process. Think of it like this. First, there's a quick check for everybody, which is called screening. Then, if that first check raises any red flags, we move to a much deeper investigation, and that's called an assessment. Let's start with that first step.
All right, so screening. This is the first line of defense. It's designed to be a fast, simple way to spot any potential nutrition risks as soon as a patient comes through the door.
Honestly, the best way to think about nutrition screening is like a smoke detector. It's not there to tell you exactly where the fire is or what caused it. Its job is to go off, loud and clear, the second it detects a problem, signaling that we need to pay closer attention. It's a quick check, usually done by a nurse or doctor right when a patient is admitted.
And what's really interesting is how straightforward these screening tools are. We're not talking about complex lab tests here. These are universal, standardized questions that look for really clear warning signs. Things like, has the patient lost weight recently without trying? Or have they been eating a lot less than usual?
This chart lays out the difference perfectly. Screening is that wide net, that quick check for every single patient to catch potential risks. But once that alarm bell rings, the patient is handed off to a specialist, a dietitian, who does the assessment, which is a full-on diagnosis.
And that brings us to the next phase, the assessment. This is where the real detective work begins, as the dietitian takes a much deeper look into the patient's nutritional health.
Now, to make sure everyone is speaking the same language, experts from all over the world came together and created a global standard called GLIM. It's basically a consensus, an agreement approved by all the major clinical nutrition societies on how to diagnose malnutrition. It ensures a consistent approach, whether you're in a hospital in Boston or Bangalore.
And GLM makes it pretty straightforward. The diagnosis rests on two pillars. First, the dietitian looks for at least one physical sign, things you can see or measure, like weight loss or muscle wasting. Then they look for at least one underlying cause, like the patient hasn't been eating enough or their illness is causing a lot of inflammation. If you have one from each category, that's a diagnosis.
Now, within that GLIM framework, there's a tool that's widely considered the gold standard. It's called the Subjective Global Assessment, or SGA. And for good reason, one study showed that almost 90% of clinical professionals use it. It's that trusted.
And you can see why it's so highly regarded. The SGA is incredibly thorough. It goes way beyond just the number on a scale. It looks at the patient's history, their symptoms, whether they're stuck in bed, and it even includes a physical exam to actually check for signs of muscle and fat loss. It truly builds the complete picture. Okay, so let's zoom in on one part of this assessment that's so simple yet incredibly powerful: the hand grip test. It's exactly what it sounds like, a test of a patient's strength.
So a clinician will use a little device called a dynamometer, and it does way more than just measure a handshake. This simple test is a proven, reliable indicator of a patient's overall muscle mass and functional health. Basically, a weak grip often means a weak and malnourished body.
So just how much does this matter? Well, let's look at this number: 7.8 times. A study on liver transplant patients in India uncovered a pretty shocking connection.
That's right. Patients who had a low grip strength, below a certain threshold, had a nearly 8 times higher risk of dying. It's a stunning example of how a simple objective number can quite literally predict a patient's chances of survival.
Okay, so we've done the screening, we've done the deep dive assessment. So what's the point of all this data? Well, it all leads here, setting a nutrition target and creating a real, actionable plan for recovery.
But this is where the rubber meets the road, and it can be tough. One of the biggest problems in any hospital is that patients often just don't eat enough. Maybe the food doesn't taste good,
or they feel nauseous, or for a million other reasons. So just putting a tray of food in front of them isn't enough. You have to monitor what they're actually eating.
And it makes a huge difference. This data from a massive global study called the Nutrition Day Survey draws a crystal clear line. Patients who ate less than half of the food they were given had a significantly higher mortality risk. The link between eating enough and surviving is undeniable.
So the final step in this whole process is to take everything, the screening, the assessment, the grip strength, and create specific, personalized nutrition goals for that individual patient. But as we've learned, setting the goal is one thing. Actually helping the patient meet that goal is the real challenge, and it takes constant work and support.
And that leaves us with one last thing to think about. We've seen just how life or death proper nutrition can be in a hospital. This isn't just some abstract clinical idea. So it makes you wonder, in our own experiences for the people we care about, is this hidden factor really getting the priority it deserves?